My name is Ignacio Armas. I am a board-certified OBGYN physician. I've been practicing OBGYN for the last 40 years. I started treating patients with bioidentical hormone replacement therapy in 1986. About 20 years ago, I started with the bioidentical hormone replacement therapy pellets. Since that time, I've treated over 20,000 patients with excellent results. I am often asked who are the best candidates for pellet therapy. Really, any female that's having hormone problems, hormone imbalance, hormone issues. It could be someone as early as in the mid to late 30s, or it could be someone in their late 60s or 70s. I would say easily 99% of the patients that are treated with bioidentical hormone replacement therapy do fantastic with it. They're happy. They tell their friends, their relatives, co-workers, neighbors, even strangers in the mall. So it's really worked fantastic for our patients. It relieves menopausal symptoms, and it also helps with underlying prevention of things such as bone thinning, heart issues, and urinary incontinence, and other ailments that are associated with menopause. One of the questions that I often get from a new patient is, what is the pellet insertion procedure like? The insertion procedure is very, very fast and very, very easy. The area around the hip is cleansed with an antiseptic. We use lidocaine to numb the skin, and then a very tiny incision is made. The pellet is inserted, and the skin is approximated with steri strips and a bandage put over it. The patients leave the bandage on for about 3 hours and the steri strips for 3 days. Another question I often get is, how big are these pellets? The pellets vary in size depending on the dose. They range from low dose estradiol pellet being very tiny and much smaller than a Tic Tac to a testosterone pellet with a larger dose being just slightly longer than a Tic Tac, but much thinner than a Tic Tac. One of the many advantages of bioidentical hormone replacement therapy pellets is that the dosing is individualized to the patient. Not only is it individualized, it's individualized each and every single time a pellet gets inserted. A typical patient will have blood work done, and then the dose is calculated according to the height, weight, age, and levels of hormones. After the first pellet insertion, blood work is repeated in 3 weeks, and the patient is seen in 4 weeks. The vast majority of the patients, when they return in 4 weeks, are already feeling much better. The levels are compared to before and after the pellet insertion. I go over with the patient how they're feeling, and then we determine when the next pellet insertion should be done. The vast majority of patients have tremendous relief and improvement on the symptoms by the time I see them 4 weeks after the first pellet insertion. Some patients tell me that they see improvement within 48 hours of having the pellets inserted. Everyone's different, and people see results at different times, but the vast majority of patients are feeling better by the 4th week.